What makes a strong patient presentation under pressure? Imagine being in a busy hospital ward with multiple patients and tight deadlines. Your ability to communicate clearly can make a real difference in patient care. When you're on clinical rotations and the pressure is high, how do you make sure your patient presentation hits the mark? It all comes down to a few key points. First, start with a focused opening statement. Include the patient's name, age, and the main reason they are in the hospital. If they have been there for a few days, mention how long. This sets the scene quickly. Then give a brief summary of their history. Highlight recent changes in their condition, like new symptoms or recent procedures. Be sure to include vital signs such as blood pressure, heart rate, respiratory rate, temperature, and oxygen saturation. Point out any physical exam findings that are abnormal or have changed since the last assessment. Next, present relevant diagnostic data like lab results or imaging findings, but keep it concise. When discussing treatment, mention what medications or therapies are currently being used. To stay organized, use a structured format like the history and physical or the SOAP method. The SOAP format breaks down into subjective information from the patient, objective findings from exams and tests, assessment of the situation, and the plan for treatment. This helps keep your presentation logical and complete. Tailor your talk to what your audience wants to hear. Some attendings prefer a quick summary focused on clinical reasoning, while others want detailed data. Practice your presentations regularly and seek feedback from supervisors or peers. Watching experienced clinicians during rounds can teach you effective styles. Stay calm and speak clearly, even when you're feeling stressed. Take a moment before starting to gather your thoughts. Use a steady voice and confident body language to show you know your material. Be concise but thorough, demonstrating your understanding of the case. Finally, show your clinical reasoning by explaining why you think certain diagnoses are more likely and what your next steps are. Connecting the dots between patient data and your plan shows you are engaged and thoughtful. To sum it up, a strong patient presentation under pressure involves a clear opening, organized summary, structured format, audience awareness, regular practice, confident delivery, and solid clinical reasoning. Mastering these elements helps you communicate effectively during busy rotations and can earn you positive feedback from your team.